Well, Findata is a data permit authority, so our purpose is to secure and streamline the secondary use of this very sensitive health and social care data. So I would classify the structure as either a one-stop shop or a single point coordinator or a service operator. Basically, it's possible through us to get access to data sets that are combined from different controllers of data. The permits are necessary because the law says so. So health and social care data is classified as sensitive data, and therefore for using that for other purposes than for its primary use, which is taking care of the patient, requires a permit. And the permit actually defines how it can be used and for what. 95% of our applicants apply permit for scientific research. So basically they're academic or company-based scientific researchers. One possible situation when it could be or can be granted if the data needs doesn't meet with the utilization. So you cannot just get data for nice to know purposes, or so it needs to have this specific purpose. And as I said, most of our applicants apply the data for scientific research. So the basic requirements are that there is a responsible researcher, adequate research plan and data utilization plan, and that the results will be published in a peer-reviewed publication. Okay. Since the essence of science is bringing new information. The secondary use of health and social care data in Finland is nothing new, but it's now organized differently. So we basically hope to solve different threats that are related to data security and data protection, and also to streamline the permit process and data collection related to the secondary use. And one example could be a medical research where the data is often required from various different healthcare service operators and the registers of Finnish Institute for Health and Welfare, national registers, Social Insurance Institution of Finland. And previously, the researchers had to submit separate permit applications to these different controllers and link the data themselves. Now it's kind of our job to simplify the process and compile the data and provide online tools for safe accessing the data. For individual data subjects, such as me, this model means that their sensitive data is more securely handled thanks to the kind of uniform and regulated information security protocols. And for researchers, it will offer faster access to data, more efficient access to data. For controllers, it means less overlapping administrative burden. And for society as a whole, it means that the healthcare and social care quality and data quality would enhance in the long run, as the data can be utilized more efficiently, and so that it will benefit the whole society. Well, of course, the research function would be one aspect, but then we can also look at it as kind of knowledge-based management. So if you're a health service provider, with the secondary use of the data, you can kind of coordinate your own operations more efficiently and offer services like earlier than to the patients, so that they will benefit them more. That could be one case. using it. And of course, through statistics, we can see bigger trends and aspects that can then affect on people's everyday life.